The first medical priority is to stop all severe bleeding. The responder should assess for both obvious and unrecognized hemorrhage and control all sources of significant compressible bleeding. This is accomplished by the use of a tourniquet on extremities and wound packing and pressure dressings on other areas. The bleeding assessment must be performed rapidly, and the focus should be on the compressible areas of the body in which life-threatening bleeding can be controlled. Using their hands, the responder must sweep the casualty's body to detect penetrating trauma. The initial bleeding sweep is done while the casualty is clothed, and any wounds that are found are quickly exposed. The technique for performing this sweep is to keep your fingers together. Spread fingers provides an opportunity to miss a small entrance wound. Unlike routine assessment techniques, the rapid bleeding assessment begins with the legs, drawing the focus on the femoral arteries. Starting on the front of the legs, the sweep initiates at the groin and continues to the feet. Then the rear of the legs from the buttocks to the feet. Next is the neck, focusing on the sides where the carotid arteries and jugular veins are located. After the neck has been assessed, the sweep continues down both arms, starting at the armpits to the hands. Any severe bleeding that is discovered must be immediately controlled with direct pressure or tourniquets. A sweep of the chest, abdomen, and back should be conducted for penetrating trauma. Any open or sucking chest, back, or abdominal wounds should have an occlusive dressing applied and secured. It's important that the victim be monitored for a development of a potential tension pneumothorax. Next, the head should be swept for severe bleeding. If any severe bleeding is found, appropriate direct pressure should be applied. The use of direct pressure should not be applied to a wound that has fractured or penetrated the skull. In this case, the responder can control the bleeding by pinching the inner and outer layers of the scalp between his or her thumb and finger. This pressure must be maintained for 5 minutes, or 3 minutes if a hemostatic agent is used. The bleeding sweep is intended to rapidly locate all life-threatening bleeding that can be controlled in the field and all torso wounds that compromise breathing within 30 seconds. First, we'll demonstrate it at full speed. Now we'll break it down step by step. Place the casualty on his or her back. Approach from the feet. Kneel next to the casualty. Look and sweep the front of the legs from the groin to the feet. Roll the patient towards you and look at and sweep the back of the legs from the buttocks to the feet. Roll the casualty on their back. Look at and sweep the sides of the neck. Look at and sweep the arms from the armpits to the hands. Immediately treat identified life-threatening bleeding as it is found with tourniquet application or direct pressure. Look at and sweep the chest and abdomen. If the casualty is wearing armor, loosen and lift the armor to perform the sweep. Do not remove the armor as it is their protection. Roll the patient towards you and look at and sweep the back. Apply occlusive dressings to any penetrating wounds. Look at and sweep the head. If the first responder is alone, the standard practice is as follows. Complete the initial sweep of the legs, neck, and arms. Immediately treat any severe bleeds by applying tourniquets or direct pressure. Sweep the chest, abdomen, and back and apply occlusive dressings to penetrating trauma. Pack wounds that are being controlled by direct pressure and pressure points. Sweep the head and treat for bleeding. If there are additional responders, The responder performing the sweep will direct other responders to apply tourniquets or direct pressure as wounds are found.